Now the new treatment helping people who suffer from painful dry eye syndrome. It's high-tech and it doesn't hurt.
It's like you've got sand in your eye and you cannot get it out, so it just hurts all day.
It's very painful. I don't sleep very well.
Your eyes get tired, and then, when you have these infections, it's pretty gross.
In its most severe form, you get scarring and it actually affects their vision.
It's called dry eye syndrome, and optometrist Henry Heron says it affects a large number of his patients.
It's more prevalent in old people, but the young people who have the dry eye syndrome, they are really some of the most miserable.
It's a horrible thing to live with, to be honest. It really is.
Teacher James Bennett suffered so badly from dry eyes it affected his job.
Getting through a full day's work was close to impossible. At one point I was putting drops in my eyes every half an hour.
It was the same for Jocelyn Thomas.
I was getting to the stage where I said, if it doesn't clear up shortly, I'm going to have to leave work at lunchtime because I'm not very productive in the afternoon.
You basically can't function very well because you're continually running and putting drops in, so...
Lisa Jane Kerr is another victim, and so is Monica, who's tried everything for relief.
Yes, I've tried the fish oil and flaxseed oil and,
drops and what have you?
Yeah. And they do give some relief.
There is no cure, but now a treatment that's changing lives.
3, 2, 1.
Monica is having her first ever treatment.
Did you feel anything there at all?
Oh,
a bit warm?
A little warm
Little
thing,
warm?
yeah.
But no nasties, no pain?
No.
It's called IPL, or intense pulse light, and until now it was used for cosmetic skin treatments.
So historically, what they by accident worked out that people who are having skin treatments, a lot of them, their dry eye got less bad. And one more on this eye. 3, 2, 1.
Monica gets 5 pulses of light under each eye.
It's good. It's painless. So, yeah, I'm just looking forward to getting some relief.
What it does, that intense pulse of light stimulates these glands. And when those glands get stimulated, the stuff that it produces is of much higher quality, and very much like an engine oil in the engine, it makes the tears lubricate much better.
So James, how quickly did you notice a difference?
I think after the second or third treatment.
After the first one, it was noticeably different, better.
In spite of Jocelyn's immediate improvement, optometrists recommend at least 3 treatments over 6 weeks.
I've had the 4, yes, and I'm so happy. I don't use drops at all now, so I'm excited about that. I get a good night's sleep, I can read, so it's worked. Yeah.
The research has just been published by the ophthalmology department in Auckland, so it's double-blind, proper research, and they've shown this is not witchcraft. They had an 85% improvement in the quality of tears in those patients who had the treatment.
Right now, optometrists are charging up to $250 a treatment, so it's not cheap, and you can't claim it on health funds yet. But sufferers say it's worth it.
I recommend it to anybody, and I say, look, the cost is just nothing compared to how great you'll feel.
It's sort of one of those things that you have to do. I mean, you have to get well if you can, and without it, like I said, I couldn't work.
Oh, well and truly worth the money, well and truly, yeah.
And optometrist Henry Heron is more than happy to recommend it.
We are there trying to make miserable patients less miserable. This is something to reduce the misery index. Yeah.
And you can find more information on that treatment at our website.